When I look back over the 24 years I've worked in York, the proudest moment for me in all of that time was the opening of a renal unit in York Hospital. I was told when I entered the hospital, when I joined the hospital, that to forget ever getting renal services into York, and the discomfort and the inconvenience that presented to patients dialysing in Leeds 3 or 4 times a week was just immense. Very shortly we will be celebrating 15 years since the opening of that unit, and we've seen a development of the service into Easingwold and into Harrogate, and now into offerings in our community hospitals, allowing the patients to self-dialyse in safe surroundings, minimising the inconvenience to them and maximising the service we can provide to them. And this is very much at the heart of putting patients at the centre of every one of our considerations when we develop services for people of North Yorkshire.
One of the first business cases that I was involved in at York was the business case for the renal dialysis unit. And subsequently to have been involved in business cases for satellite dialysis units, for extensions of peritoneal dialysis, the development of home hemodialysis, and latterly self-care dialysis. It has been excellent to have been involved in those business cases and see those developments. Sometimes working with clinicians like yourself, Paul, these opportunities come along to develop services and to move to the next level. And with the self-care dialysis unit that opened at Selby, it's been something of an experiment for us, but it's been an experiment that from now talking to the patients through the unit, from talking to Rachel on the unit, understanding the benefits that unit has brought to patients like Rachel is fantastic, and it's great to have been involved in that.
One of the dilemmas we have doing the type of job we have is that we end up managing health services, supporting the development of health services in quite an artificial environment. And talking to a patient who is committing to self-dialyse brings home the reality of what we've helped support, but importantly, what you've led. Absolutely to her benefit, and she was very articulate in the benefits and the independence that brought to her life, and fundamentally revolutioned the way she lives her life. And there can be no greater satisfaction for people like me, people like you working with clinicians like yourself, Paul, to provide that type of service for patients, provide that opportunity for them.
There's a story to tell with the developments of renal at York, as we've seen the various stages moved forward. Exciting developments for us going forward are the opening of the self-care dialysis unit at Harrogate, fantastic purpose-built building that we'll see open in the new year, 4 stations for self-care dialysis, and it will be great to see that idea come to fruition. Next stage is going forward for us, further expansion of self-care. We'd like to see those same facilities provided in the York locality. We've also aspirations to develop in the broader North Yorkshire patch further self-care, and also holiday dialysis facilities as well. A real clear vision, clinically led, and makes sense in the healthcare financial environment as well. This has worked for us as an organisation. It's worked because of clinical enthusiasm. The feedback from patients is excellent, but it has worked for us on a business perspective as well. And to me, in my role, that is something that's important, and that's how these ideas have longevity and survive.
You know, as an organisation, we've fundamentally changed in the last 2 or 3 years, and we now provide services over an area of 3,500 square miles, community hospital in Whitby, one in Bridlington, one in Selby, one in Easingwold, sort of providing the perimeter to that geographical location. And I think the development of renal services servicing the population of that whole county through using the various options open to us is a fantastic demonstration how an organisation like ours can genuinely serve the community and benefit from that as well. Puts a patient at the centre of everything we do. All our thinking is about how we serve the patient. And in a county like ours, serving a very distributed population, if we can do it, why can't anybody else?